रब्बी इश्रह ली सदरी व यस्सिर ली अमरी वहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। अल्लाहुम्मा इन्नी अस्अलुका इल्मन नाफ़िअन रिज़्क़न तय्यिबन अमलन मुतक़ब्बला शिफ़ा मिन कुल्लि दा। Today the topic of discussion is infertility. Infertility, significant social and medical problem affecting the couple worldwide. Average incidence of infertility is about 15% globally, varies in different populations. Some causes can be detected and treated, whereas others cannot. Unexplained infertility constitutes about 10% of the all cases. Inability to conceive after 12 months of having sexual intercourse with average frequency 2 to 3 times per week without the use of any form of birth control. Types of infertility. Primary infertility, couple have never produced a pregnancy. Secondary infertility, woman has previously been pregnant regardless of the outcome and now is unable to conceive. Conception and fertility. The chances of conceiving in any given menstrual cycle is less than 20%. Main events necessary for pregnancy to occur are ovulation, fertilization, implantation. Any condition that interferes with these events may result in infertility. Factors affecting fertility. Frequency of intercourse. Coital frequency is positively correlated with frequency rate. Frequency of the intercourse 1 times per week leads to the 17% probability of conception within 6 months. 3 times per week leads to the 50% probability of conception within 6 months. Factors affecting fertility. Timing of intercourse. Intercourse just before ovulation maximizes the chance of pregnancy. Sperm survives as long as 5 days in the female genital tract. Ovum life expectancy is about 1 day if not fertilized. Sperm should be available in the female genital tract at or shortly before ovulation. Factors affecting fertility. STI and other infections. Sexually transmitted infections, gonorrhea and chlamydia can cause in women pelvic inflammatory disease, major cause of tubal infertility and cervicitis. In men, urethritis, epididymitis, accessory gland infection. Mumps leading to the orchitis may cause secondary testicular atrophy. Other infections that may affect fertility include tuberculosis, toxoplasmosis, malaria, schistosomiasis, and leprosy. Factors affecting the fertility. If we continue, that is the age of women after 40, the fertility rate decreases by 50% while the risk of miscarriage increases. Age of men. Increased age affects coital frequency and sexual function. Nutrition. For women, weight 10% to 15% below normal or obesity may lead to less frequent ovulation and reduced fertility. Factors affecting fertility. Factors that can contribute to fertility problems include toxic agents such as lead, toxic fumes and pesticides, smoking and alcohol. All these factors may cause in women reduced conceptions and increased risk of fetal wastage. In men, reduced sex drive and sperm count. Infertility, female and male factors. Infertility may be a result of one or more male or female factors. Male and female factors, they are equally responsible for infertility, 30 to 40% each. In 20% of the cases, there is a combination of both factors. Evaluating both partners is essential. Requirements for the female fertility. Vagina capable of receiving sperm. Normal cervical mucus to allow sperm passage. Ovulatory cycles. Patent fallopian tubes, both tubes should be patent. Uterus capable of developing and sustaining pregnancy. Adequate hormonal status to maintain pregnancy. Adequate sexual drive and sexual function. Normal immunologic response to accommodate sperm and conceptus. Adequate nutritional and health status to maintain nutrition and oxygenation of placenta and fetus. Requirements for the male fertility. Normal spermatogenesis in order to fertilize egg. Sperm count, motility, biological structure and function, normal ductal system to carry sperm from the testicles to penis. Ability to transmit sperm to vagina, achieved through adequate sexual drive, ability to maintain erection, ability to achieve normal ejaculation, placement of the ejaculate in vaginal vault. Causes of female infertility: pelvic inflammatory disease leading to blocked or damaged fallopian tubes may interfere with fertilization and transport of egg, ovarian dysfunction resulting in absent or diminished egg production. Local factors in the uterus and cervix may interfere with implantation and women's ability to carry pregnancy to term. Luteal phase defect results in low production of progesterone, may lead to early miscarriage. Production of anti-sperm antibodies can interfere with fertilization. Causes of male infertility: that conditions that affect quality or quantity of the sperm may lead to infertility. These includes varicocele, primary testicular failure, accessory gland infection, idiopathic low sperm motility. Causes of infertility affecting both partners: psychological. Sexual behavior may reflect couples derived not to have children. Immunological incompatibility may cause sperm agglutination. Unknown causes. Basic workup for infertility: evaluating both partners is essential. Detailed history and physical examination for both. Sperm analysis, evidence of ovulation, evidence of fallopian tube pregnancy, patency. That is the evidence of ovulation, evidence of fallopian tubes patency, post-coital test, still performed by some clinicians, not found valid by some studies. Fertility evaluation, that is journal and sexual history. Journal history. Occupation and background: use of tobacco, alcohol and drugs, history of abdominal surgery and earlier diseases and infections, sexual history, sexual disturbances or dysfunctions such as vaginismus, dyspareunia or erectile dysfunction, sexually transmitted infection. Vaginismus is a painful spasmodic contraction of the vagina, often rendering copulation impossible. And dyspareunia is painful coitus. Fertility evaluation: obstetric and gynecological history, reproductive history, gynecological history, age at menarche, menstrual periods, that is duration and intervals, previous contraceptive use, previous testing and treatment for infertility. Now, evaluation and pelvic examination for the woman to rule out the endocrinopathy, congenital anomalies, uterine hypoplasia, cervical lesion, and dyspareunia, that is painful coitus, which is again is superficial and deep. Inshallah, we will discuss in the next few lectures what is this dyspareunia is in detail. Visual evaluation and penile examination for men to rule out hypogonadism, tumors, epididymal cyst, cryptorchidism. It is a condition in which one or both the testes fail to descend from abdomen into scrotum. Then is the hydrocele, accumulation of serous fluid in a body sac. It may progress over the years. And varicocele, it is an enlargement of the veins within the loose bag of the skin that holds testicles. A varicocele, it is similar to a varicose vein you might see in your legs. It's a common cause of low sperm production and decreased sperm quality, which can cause fertility. Female evaluation of the female, that is partner, evidence of ovulation. It includes urine test. Measure the luteinizing hormone in urine to detect if and when ovulation occurred. Basal body temperature test, BBT. That is, temperature is measured every morning before woman gets out of bed. Elevation in temperature indicates ovulation. Fertility evaluation of the female partner includes progesterone test. Progesterone level in blood is measured on day 21 or 22 of 28-day cycle. Endometrial biopsy done during premenstrual phase detects if endometrium undergoes expected changes consistent with ovulation and production of progesterone. It includes fertility evaluation of the female partners, hysterosalpingogram, HSG, to determine whether fallopian tubes are blocked, laparoscopy to evaluate for pelvic disease such as endometriosis and check patency of fallopian tubes, hysteroscopy to evaluate condition of uterine cavity, that is polyps and fibroids. Fertility evaluation of the male partner, semen analysis. Semen is studied for a number of factors including the volume, 1.5 cc to 5 cc, that is number of sperm present, that is more than 20 million per mil, sperm motility more than 60% and forward progression more than 2 on scale 1 to 4, morphology more than 60% normal forms, presence of any infection. Fertility evaluation of the male partner. Also other tests include urine analysis to rule out infection, endocrine test to measure the concentration of the hormone testosterone, follicle stimulating hormone and luteinizing hormone, anti-sperm antibodies, sperm penetration assay to establish the ability of the sperm to penetrate the eggs, postcoital test, low validity to establish ability of the sperm to penetrate cervical mucus. Treatment possibilities. Female infertility, that is ovulation disorders. Ovulation inducing drugs are given. Hyperprolactinemia, prolactin suppressing drugs is given for this case. Uterine and tubal abnormalities, surgical procedures are performed to correct it. Cervical mucus problems, intrauterine insemination is useful, but its efficacy is only 16 or 20%. Endometriosis, suppressing the hormones or surgical procedure is done. Treatment of female infertility, that is induction of the ovulation, involves the use of medication to stimulate development of one or more mature follicles. Success rates vary considerably and depend on age of woman, the type of medication used, whether there are other infertility factors present in the couple and other reasons. Treatment of the female infertility evaluation, that is ovulation induction agents, clomiphene citrate. It induces release of gonadotrophins. Gonadotrophin releasing hormones analog similar in structure to the natural GnRH provoke a massive release of GnRH into the circulation. Gonadotrophins, that is human menopausal gonadotrophins, which contains equal quantity of the FSH and LH, bromocriptine, suppresses production of prolactin. Treatment of female infertility, intrauterine insemination, a fertility procedure in which sperms are washed, concentrated and injected directly into a woman's uterus. Increases the number of sperm in the fallopian tubes, not recommended in cases of tubal blockage, poor egg quality, ovarian failure and severe male factor infertility. Most successful when coupled with drugs inducing ovulation, success rate of 5 to 20% per cycle. Treatment of the female infertility, assisted reproductive techniques ART, non-coital methods of conception, includes all fertility treatments in which both eggs and sperms are manipulated. Types of ART includes in vitro fertilization, zygote intrafallopian transfer, ZIFT, gamete intrafallopian transfer, that is GIFT. ART in vitro fertilization includes retrieving eggs and sperm from female and male partners and placing them in a lab dish to enhance fertilization. Fertilized eggs are transferred several days later into the uterus. Ovarian stimulation drugs are used prior to procedure in order to retrieve several eggs and maximize chances for successful fertilization. Success rates are about 20% per egg retrieval. Now, gamete intrafallopian transfer, that is GIFT, is a procedure that involves ovarian stimulation, retrieval of the eggs, placing a mixture of the sperm and eggs directly into the woman's fallopian tube. GIFT does not allow dual conformation of fertilization. Success rates per egg retrieval, they are about 28%, higher than IVF. GIFT, that is ZIFT, again, that is zygote intrafallopian transfer, also called tubal embryo transfer, is another variation of IVF. As with IVF, the actual fertilization takes place in a lab dish. Fertilized eggs are placed directly into a fallopian tube. Success rate is about 29% per egg retrieval. Treatment, possibility of the male infertility. Surgical treatment is, in some cases, in the case of varicocele, intrauterine insemination can be performed either with patient's or donor sperm. ART procedures, that is GIFT, IVF, and ICSI, that is intracytoplasmic sperm insemination. Donor sperm should be free from STDs and HIV, that is sexual transmitted diseases, and human papillomavirus, that is AIDS. Intracytoplasmic sperm injection, ICSI, involves injection of the single sperm into the eggs. The woman is administered fertility drugs prior to the procedure to aid in the production of multiple eggs. Only active, undamaged sperms, they are selected for injections. Intracytoplasmic sperm injection, ICSI. Eggs are observed to see if fertilization takes place. Average fertilization rate is 65%. Implantation into the uterus takes place within 72 hours after ICSI. Success rate range from 15 to 35% per egg retrieval. Infertility, we do the summary. If you summarize, infertility is a significant social and medical problem affecting couples worldwide. Female and male factors are equally responsible. Evaluation of both partners is essential. Treatment depends on the cause of infertility and varies from ovulation-inducing drugs to surgery to ART. With this, I end with my lectures, and I hope it will help in your studies and exams.